Well, good morning, everybody. My name is Trevor Schell, and I'd like to welcome you to our final RSI Day webinar of 2024. Today marks the official RSI Day, which is February 29th, the only non-repetitive day. It's truly bittersweet as it marks the 25th anniversary of a day that was created to increase the awareness and prevention of musculoskeletal disorders. Yet 25 years later, here we are still doing the exact same thing. Yet on the other hand, 25 years ago, I was speaking to 20 people in the basement of a union hall here in Sudbury. And today, I'm speaking before an international audience. As a matter of fact, across the 4 sessions, we have 1,849 registrants from 53 different countries. Looking back over the last 25 years, I go from moments of sadness to joy over what we've created, because again, we're still doing the same thing 25 years later. But just from our registration alone, we know that this isn't just an Ontario issue, or Canadian, or North American. It's worldwide. In our first session this year, our presenters included Catherine Fennick, the founder of RSI Day, who spoke about the fact that she created RSI Day due to her frustrations with both the Ontario medical and compensation systems, and the fact that they are both broken. Our second presenter that week spoke about the fact that injury rates are not decreasing. Instead, workers are not submitting WSIB claims, and instead are working injured and seeking opioid use to reduce their pain to allow them to continue working. Here in Ontario, our statistics are supplied by WSIB. But did you know these stats are only based on the number of claims we've accepted? What about the total number of claims filed that they have denied, often for ridiculous reasons? Here's an example of a patient file I worked on. This gentleman was a heavy equipment operator, employed for 23 years, and worked between 40 to 60 hours per week, and was diagnosed with bilateral carpal tunnel syndrome. WSIB denied his claim, stating, "Your regular job as a heavy equipment operator included manipulating joysticks and is considered low risk for carpal tunnel syndrome, as there is no sustained forceful pressure, no strong gripping, and no awkward hand postures or vibration." However, through analysis of different physical demands for heavy equipment operators, we were able to establish a profile of known risk factors for the development of carpal tunnel syndrome, such as gripping, awkward postures, and exposure to low-frequency vibration. I also conducted a review on the equipment design, such as the manufacturer's joysticks. Newer heavy equipment joysticks not only control the boom arm, but also steer, rotate the cab, raise and lower the boom, open and close the claw, stabilize control, slewing gear brake operation, the horn, and elevate the cab, all of which results in almost constant use of the hands while in operation. Even the default design of the joysticks has a worker's wrist in an angle position of 18 degrees from the vertical axis and angled forward 27 degrees. So just by staying in a static position, not manipulating the joysticks, they're already in awkward postures. So let's review that reason for denial of their compensation claim again. They stated there was no strong gripping, yet the PDA showed us they were gripping for about 72%. No awkward postures. This ranged anywhere from 50 to 83.5%, and no exposure to vibration. Again, 75.2%. So despite the statement by WSIB for their denial, the worker was indeed exposed to all of these risk factors. Keynote week focused specifically on different musculoskeletal disorders in order to educate you about them. Our registrants range from injured workers, advocates, Joint Health and Safety Committee members, researchers, ergonomists, to physicians, all of which are people who need to know this information. Week 3 show the benefit of ergonomic interventions using cost-benefit analysis, and also the importance about the recognizing the effects of mental health issues. And now, here we are at week 4, which is focused on prevention of these disorders with the development and revisions of 6 new programs: historical, controversial, education, validation, and prevention. These were the goals for this year's RSI Day, which we have accomplished. Don't ever forget why we're here. Don't become complacent within a broken system. Continue to question, continue to seek, continue to expand. Never stop trying to do what is right. And now I'm going to step down from my soapbox to remind you all that today's session will be recorded and the importance of answering all survey questions that will appear in the chat. These are a metric that we use to evaluate our sessions. Next week, I will be sending out an email to all our registrants to complete about not only evaluating RSI Day 2024 as a whole, but also asking for volunteers to assist with beta testing of the tools that we're presenting today. The chat is also being monitored, so please ask any questions for the presenters there. And introduce a very special guest speaker to open today's session, Dr. Joel Moody, the Chief Prevention Officer of Ontario. Dr. Moody, good morning.
Good morning, Trevor. Apologies for not having my buttons working very well, but I think we're there. So first and foremost, everyone, I want to say thank you for allowing me to come kind of on your last day. Part of this RSI, Repetitive Stress Injury Awareness Day series. Our colleagues at OCal, the work you do is just amazing. And as I said, Trevor said, my name is Dr. Joel Moody. I'm the Chief Prevention Officer for the province of Ontario here in Canada, as well as the Assistant Deputy Minister of the Ministry of Labour, Immigration, Training and Skills Development. And really wanted to just say, first and foremost, Trevor, you did a great job around the 25 years. Unfortunately, we're not as far as we want to be in the system, but we're going to continue to make strides and improvements through the work, through the construct, through the collaboration, through the communication that we have together. And it's really up, some aspects that are from you, starting in those days back in Sudbury at Cambridge College, which there was an older technology in use at the time. My staff told me it was EDOM. Hopefully that's the right one. But look at where we are now. And that's a testament to you. That's a testament to OCal. That's a testament to your colleagues and the other ergonomists that exist, because you're talking about real life issues that are there within the daily life of individuals in their operations at work. We know that we can improve. We know that we can prevent. And so a lot of the things that we're talking about, and so your presentations I had a chance to look at before today, they're all in reference to repetitive stress injury, which is, as we know, a major cause of lost time injury, both reported and unreported. We know it has dramatic impacts to quality of life of individuals. And so what can we do? And so I know some of the work that will be presented a little bit today is about a tool that's being developed. And I'm very happy to hear and learn more about its kickoff today. So once again, as one of the funding partners that we work with our colleagues at OCal, seeing the Ergo tool firsthand. It's been revised, it's been updated, newness that's coming. Happy to see that it's continually putting the worker at the center of what we do, putting the worker at the center of what we need to be considering when it comes to the prevention of occupational injury, illness, disease, and unfortunately even fatalities at times. So we know OCal, you've been very hard at work. You've also released the silica tool, which is, once again, when we talk about exposures, so also important as well. All of our health and safety partners are pushing and striving to be innovative, find those things that are really making differences in the lives of workers each and every day. Because to your point, we know that they exist. Last time I checked, The human body still functions the same way. The number of bones in our body hasn't changed. The mechanics haven't changed. But what has changed is the nature of work. What has changed is how the work and the individual interact with each other. And that's where, how do we find new innovative opportunities to address these age-old challenges that we have? And that's where my excitement is. So I want to say thank you very much for having me to kind of open your day. Look forward to being with you through some of the sessions. And Ocal and Trevor, once again, great job as always. Thank you so much.
Thank you, Dr. Moody, and it's great to have you here with us.